Hi everyone, and welcome to today's chat. My name is Trinia. I'm a team member here at Understood. And today we're going to be talking about processing speed. And we're super lucky to have Ellen Braaten joining us. And actually, Ellen, we have talked about this topic lots of times, and we're super excited to have you back with us again. Do you want to give our viewers just a little more background info on you?
Sure. I am a child psychologist. I work at Massachusetts General Hospital and Harvard Medical School. And before I became a psychologist, I was a special education teacher. So I'm very interested in how kids learn. And my clinical practice is in assessing kids with learning and attention issues. And my research focuses on a specific area of learning, which is called processing speed. And a few years ago, I wrote a book called Bright Kids That Can't Keep Up. And I'm still researching this topic and learning more about it all the time.
Absolutely. And for our viewers out there, Ellen's book is directed towards parents. And so if you want to learn more about this topic and you need some more strategies and advice, it's a really great book to pick up. But luckily, we have Ellen right here with us, and you can ask your questions. If you have a question, go ahead and type it in the chat box, and we'll get to as many of those as we can. But to get us started, Ellen, maybe you can start just by talking about processing speed in general, what it is and how it affects kids when they're learning.
So processing speed is really how long it takes to get someone or something done in a specific period of time. And when a neuropsychologist like me is talking about processing speed, usually we're talking about measuring it by how quickly someone can do something very mundane, something very simple in a given period of time, very often with paper and pencil, but sometimes even verbally. But it's not how quickly someone solves a problem, but how quickly someone can, for example, copy a code from a board or copy a math equation from the board, not necessarily understanding what the math equation is. That's a different process, but just how quickly we can do something. And, I'm sure most parents have heard about executive function skills. And those are those skills that allow us to use our intellect in a fluid way, in a way that allows us to shift set and prioritize. And processing speed used to be thought of as just another executive function skill, but I think of it, and I think a lot of other researchers are thinking of it as the motor that kind of drives the executive function skill. So it's an important thing. It's sort of like, again, kind of like how quickly our motor goes or how quickly we can do something. It's not how well we drive, it's not how skilled we are, but just how quickly we can get some of those simple things done. But it relates a lot to a lot of other aspects of learning.
Mm-hmm. That's really helpful. And we have some parents that are already asking us about what should they do, like if they think their kid is having difficulties with processing speed? Is this something that can be evaluated? Is it a diagnosis?
So those are two different questions. So the first one is yes, it can be evaluated and should. Because if you feel like your child is sort of like having trouble keeping up or having trouble, even if let's say they've been diagnosed with a specific learning disability in reading, something like dyslexia, but you're still finding out they're having trouble keeping up, that issue of processing speed is one that should be evaluated. Or maybe your child doesn't have a learning issue, but seems to just be having trouble keeping up. That would be evaluated in a couple of different ways. One is you can ask your school system to evaluate. And if you're specifically wondering about processing speed, what you want to make sure is that they've given a number of tests that measure speed. And so usually the Wechsler intelligence scales for children include a processing speed factor. My research has shown that that's a very good indicator of overall processing speed. But there are also other tests that can be important, like math fluency or reading fluency. It's how quickly they can do very simple math sort of problems, like multiplication facts or simple addition. So you want to make sure that that's part of the battery that's been measured. Now, kids with only an issue with processing speed do not have a problem that can be readily identified, particularly not something that's considered under IDEA or under, it's one of those sort of factors that is more of an interesting fact about somebody's learning as opposed to a diagnosable disability. However, processing speed is almost always, not always though, but almost always associated with another issue, such as ADHD, sometimes autism spectrum disorders, specific learning disabilities. And so it's important to find if there is an accompanying issue that can get a child services to diagnose that issue and pinpoint it. For some other kids, what I have found is very helpful is to look to see if there are some other areas that show functional impairment from the processing speed factor. So even if they're doing very well in math, but they have trouble keeping up in math, to measure that by looking at math fluency and to say that they've got a specific learning disability in this one area of math fluency. So that's how I sort of try and get around it. If there's not a functional impairment that you can put your finger on, it's very hard to get services.
Mm-hmm. So what I hear you saying is that if a kid is only struggling with processing speed, they might not be able to get a diagnosis or special education services. However, a lot of times there is this overlap that kids have processing speed issues and also have another challenge, whether it be dyslexia or a learning disability in math or ADHD. And so it's always worth getting your child evaluated to find out if there are other challenges going on that could also be playing a role with processing speed.
Exactly.
And I'm wondering, and we're having lots of questions come in, but maybe we can I want to ask a general question before I dive into all of these specific parent questions. What types of accommodations or supports are helpful for kids in the classroom if they're struggling with processing speed?
So the number one support is extra time on tests, extra time to complete work, even in some cases, a decrease in the amount of busy work. So for example, making sure that the child does half the problems on a math worksheet very well, as opposed to all of them so it's those sorts of things that kind of very specific to a child. But then also, again, this is where that evaluation is important, is figuring out where the processing speed is causing problems. So does it cause problems in their ability to quickly generate a narrative? In that case, they might need assistance in written expression. In math, it might, if they have trouble with sort of basic math skills, like knowing their times tables quickly, sometimes the use of a calculator in the later grades are important. But extra time and pinpointing where the functional impairment and giving them support in that way is important too. The other thing that my research has shown is very important is teaching kids how to tell time. Having them really get a better concept of time, having them wear a watch that is a clock where it's not a digital watch, but an analog clock where they're really having to follow along and seeing how the concept of time helps them organize their time better. And so those are a few things that can be very important. And then the use of technology in ways that are specific to that child can also be very helpful.
Those are great ideas. Thank you. We have questions asking about how to help kids with advocacy. And so we talk a lot on Understood about the importance of kids learning how to advocate for themselves. This parent specifically asking about a 9-year-old. And this 9-year-old has autism spectrum disorder, ADHD, and a math learning disability. And so any strategies that might help this child to be able to advocate for themselves?
So I think with a 9-year-old, you really need to be taking the long view. So by the time he's 18, he really should be able to advocate for himself. I'm a little bit reluctant to put too much pressure on a 9-year-old. And I hear this all the time. And a lot of times it comes from teachers like, well, why didn't he tell me he was struggling? Well, 9-year-olds shouldn't always know that they're struggling. They should have adults in their lives knowing that. So for a 9-year-old, I'd kind of be looking at this transitional way of advocating for himself. The first thing he really has to do is understand what he needs to advocate for. And I find a lot of kids don't really know. People will say to them, well, why didn't you tell me? Or why aren't you advocating for yourself? But they don't even know actually what advocating means or what it means, for their particular self. Like even as adults, we have trouble advocating for ourselves in a job. This is something that's, I think, a lot more difficult than we give kids credit for. So anyway, so two things. One is, does he even know what advocating is? Why that's important? And second, then he's got to understand what he needs to advocate for. So spend some time thinking about what's appropriate for him in his classroom. In terms of processing speed, I think some of the simplest things to start with are the most important. And that's like knowing when things get to feel a little bit like, I'm losing control of what's happening. Having him be more in tune with his own emotional experience, I think, can be very helpful. So when do things start to feel overwhelming? What do you tend to do at that time? Okay, let's give you some other ways of reacting to that. So for example, if things are moving too fast, for him to say, wait a minute, can you repeat that again? Or can you tell me a little bit more about that? Or, oh my, that was so much information. I got to hear that again. Things that we as adults do all the time, I think we've got to be able to think of it for him. If it's for a child on the autism spectrum, it can be very hard socially to advocate for oneself. Again, it's hard for all of us to advocate socially when we're feeling left out. And so, but I think keeping him in tune with, okay, I was in this situation and it did not make me feel really good. And why is that? And how can I intervene, or how can I use the adults in my life to help advocate for me? And that's why I think for a 9-year-old, it's not just like, well, I'm going to go in here and solve it, but like, I'm not feeling good right now, and these are the people I can go to, and they can help me figure out what I need to do to advocate for myself. Mm-hmm. By 18, he should be doing a lot of that himself.
Mm-hmm. Yeah. Oh, that's really helpful. And it probably is really related to this next question I'm going to ask, which is about social skills. And so we have a couple of people discussing social skills and how it can be difficult if you have slow processing speed or ADHD. And the people specifically are talking about teenagers in high school and even going into young adulthood and adulthood, struggling with these social interactions. Do you have any advice for how to work on these and how to approach that?
Yes. So I think one of the first things to do is just know yourself. And we tend to think that lots of social relationships are important. Quick social relationships are important. Being busy all the time are important. My research has shown that about 40% of the kids with processing speed deficits have significant social interaction impairments, and not all of them meet criteria for autism spectrum disorder. So it's a big part of what they have to cope with. And I am hearing more and more about young adults having trouble with this, and even adults having trouble with this. So one of the things you want to keep in mind is sort of like knowing you're going to have a problem with something already helps. Like that's why we go to therapy. That's why therapy is so important, is it brings what we weren't really conscious of into our conscious awareness so that we can actually do something about it. I also think that you shouldn't feel any shame about it. And I think that sometimes what I'll hear is, oh, my child, he only has 2 friends that are really close. That might be enough. It might not be too, but it might be enough. And so that's where I think you've got to take a look at what's appropriate for your particular child. The other thing is to put yourself in situations that are comfortable for you. So a lot of people with social skills challenges don't always feel great. They tend to be more on the introverted side. So being in big crowds that move very fast, or really the kinds of social relationships and social groupings where people are very savvy, almost to a fault, if you know what I mean. Like you think about the sort of high school or middle school group where things are going by fast, that just doesn't feel comfortable for them. And I think sometimes where the problems come in are when you've got a child who feels like they should be in that kind of situation, or whose parents want them to be in a higher kind of social cluster. I don't want to describe it in the right way, but where it's moving too fast. And so I think putting yourself in a situation where things feel comfortable for you is important.
Mm-hmm. Oh, I really like that point of figuring out what feels best for you and what friendships you need and how many you need. I definitely know that even just in my life and seeing how different people interact, some people like to have lots of people around them and big groups of friends, and other people really are just content with having one or two good friends and being in a more quiet environment where they feel more comfortable telling people to slow down or repeat something if necessary, and people that you just feel comfortable being around.
Yeah, and even if some people do like in a bigger group, but knowing that and knowing that sometimes having just that one person in the bigger group who knows you well enough to say, did you get that? Or that sort of thing can be very helpful.
Absolutely. Our next question is about these brain game apps or different tools or apps that might help with various challenges that kids or adults might have. And this person is saying that they use brain game apps for memory, speed, and focus. And so first I want to ask you, what is your thoughts on these types of apps? Are they helpful for these things? And is there any type of similar app that could be used for helping kids with processing speed?
It's $1 million question, and literally $1 million if someone could come up with this idea that would help. So I don't know of any. I mean, I would know of them, but there aren't any that have been shown to be effective at speeding up this processing speed issue. And I think what we're talking about is kind of a whole brain processing issue, not just sort of even focusing attention or just working on one aspect of memory, which is oftentimes sort of either visual memory or verbal memory. We're talking about more of a way of interacting with the environment. So there really aren't any things that have been shown to be effective as of yet. Is it possible we could? Maybe. To be honest, I think our best bet might be a medication issue, because again, what we're talking about is a brain-based issue, but we're far away from that too right now.
Mm-hmm. That's helpful. Thank you. Our next question is about anxiety. This person is asking, can you comment on how anxiety can play a role in processing speed?
Yes. So we also know from my research that anxiety and processing speed and ADHD as well, all sort of cluster. And what happens is if you have a child who's already kind of predisposed to anxiety, so there are kids who are kind of just genetically predisposed to that. They're kind of cautious in the world. They're a little bit more inhibited as opposed to disinhibited. And then on top of that, if they also are kind of predisposed to sort of interact in the world in a slower sort of fashion, that anxiety and processing speed creates kind of a circle that is hard to break through. So what happens when we're not sort of with the program, when we haven't kept up in a classroom situation, for example, and then all of a sudden the teacher calls on you and you don't know the answer because you're a little bit a step or two behind what just happened. Now, all of a sudden, you're sitting there, you don't know the answer. Now you start to feel anxious. Well, what happens when we're anxious? Our natural tendency for anybody when we're anxious, it's either to run as fast as we can away from something, or more often in our situation right now, it's to kind of freeze and take note, and it makes us slower. So kids with anxiety and processing speed tend to get caught in this cycle of being nervous, which makes them slower, which can make them feel like, less capable, lower self-esteem, which brings on another issue. So it's important to really give kids with both the anxiety and the slow processing speed to intervene in the anxiety, because we know what works for anxiety. Cognitive behavioral treatments work, the ability to think and problem solve your way out of things, behavioral techniques. All of these things have been very, very effective to control the anxiety. And a lot of times, controlling anxiety and therapy for anxiety is identifying it, knowing what it is, knowing the impact it has in your life. So it's quantifiable. So it's something that you can work with as opposed to being sort of amorphous. And that's we're oftentimes worried about things that we can't identify. So getting that kind of treatment is really important.
Mm-hmm. Thank you. And similarly, we have a question about the overlap of ADHD and executive function issues and slow processing speed. And we have a couple parents asking about this. And one is specifically wondering, their child has been identified as having ADHD, and they're wondering, could slow processing just be a part of the ADHD diagnosis, and should they push for further testing?
It can be. So in our studies, and I should say too, when I first started studying processing speed, my previous work, and I still do some work in ADHD. So that's how I got interested in slow processing speed. And it used to be synonymous, that you thought like, well, if you're kind of slow to get stuff done, you're probably inattentive, or you're, impulsive, so you're not doing what you're supposed to do. Now we know that it's only part of the kids with slow processing speed have ADHD, but about 60%. So there's a huge overlap between the two. So if your child has ADHD, it's more likely than not that they probably have slow processing speed too, especially if they're ADHD inattentive subtype. So it is something that you might want to have evaluated, because it does sort of help you understand where your child's going to have the most difficulty in things like written expression, in things like copying their notes from the board quickly, those sorts of very mundane sort of tasks that are hard for all of us to pay attention to. If you've got slow processing speed, it's hard for a child with ADHD to pay attention to them. And now it's harder than average for them to actually do the work. Now that kind of work is really going to be tough for them to complete. So it's good to know that, so that they can get accommodations around that.
Mm-hmm. Thank you. And our next question has to do with kids who are just learning English. So our English language learners, this person is wondering, how does being ESL or in an ESL class, how does that affect processing speed if you're still learning the language?
So it shouldn't necessarily affect processing speed. I would say it this way: if a child has slower processing speed and now they have to learn another language, it's going to take them longer. And so we know that too about, like, for example, dyslexia. If I evaluate a child with dyslexia and they have slow processing speed, what I suggest is that the standard treatment that we might say for a child with dyslexia, like 2 or 3 sessions of tutoring a week, I might say if they have slower processing speed, they're going to need 4 or 5. They just need more time to learn the same amount of information. So I would say the same sort of thing about a child who's learning to speak English, that if they're typically getting 2 hours a week of, or whatever, however many hours a week they're getting, I'd probably increase that so that they have more opportunities to learn. Once they learn it, they learn it as well as anybody else. It just may take a little bit longer. So, but I wouldn't expect a child who's got to learn an extra language to for that to necessarily slow them down, but the opposite, that if they already have a slow processing style, that it's probably going to take them longer to learn that information.
Ellen, on that note, if a kid is still learning English and they're in the classroom with all of these other kids who have already mastered English, would a teacher maybe see, like, it might look like they have a processing speed issue, but they're actually just translating from English into their original language, and so it might look like a processing speed issue, but it's not?
Absolutely. That's exactly what it could look like. And in fact, sometimes they even give the example of when, if you have got slow sort of verbal processing. So let's say you're the kind of person who just it's hard for them to comprehend what someone is saying really quickly. It's not that they can't comprehend the content, but it's coming at them too quickly. So sometimes I'll use the example of, if you kind of know a language, and let's say I know a little bit of Spanish and I go into a room where everyone's speaking Spanish, I can get a little bit of it, but if they would slow it down, I'd be able to get a lot more of it. So I use that example of how it feels for a child with slower processing speed. So yes, the answer to that is yes, that child might look slow. They might look like they have limited cognitive resources, which most likely are not the case, but that's how people look when they don't understand the language.
Mm-hmm.
Because we need it slowed down.
Oh. Yes.
Yeah.
Sorry for interrupting. Our next question is about driving. And this parent is wondering if their child has slow processing speed, are they going to have issues with driving? Is there any special like watch outs that, or anything that they can do to make sure that their child is safe while driving?
So this is a very good question. There's been no research as of yet on processing speed and driving, but there has been quite a bit of research on ADHD and driving. And it does show that kids with ADHD have more accidents, more problems the earlier they are in their driving. So it kind of depends on how slow their processing speed is. And you sort of know as a parent what we've been suggesting for the kids with ADHD, which I think apply as well to kids with slow, which is
Ellen, I
here as
think
well.
you cut out for a minute. Can you repeat the last sentence that you were going through?
Sure. What they need is more time in practicing. So they need more time to, if for example, they need 100 hours of driving with somebody, give them 150 hours. We know that you get better at driving the more you drive. That's why when our insurance goes down as we get older and are more experienced with driving. It's not just that they're adolescents, it's somewhat that, but it's because adolescents are inexperienced drivers. So give them as much practice as they can, as you can, as much practice as you are in with them. Now, the one thing that we don't know, but I would hypothesize about that's maybe different from kids with just processing speed issues and not ADHD, is that they tend to be more cautious. So again, kids with issues of processing are more often the kids who are ADHD inattentive subtype. So they might be a little bit more inattentive when they're driving, but they also tend to be more cautious, less disinhibited. So that's a good thing. They're less likely to be speeding on the road when they're not supposed to. So there are some good things that come with this kind of natural tendency to be slower at taking in information.
Mm-hmm. Thank you. We're getting close to time, but I know we started a couple minutes late, so I'm trying to get in a couple more questions. This parent is asking about note taking. Do you have any advice for helping kids with taking notes during class, especially if they're having trouble keeping up with what the teacher is saying as they're writing it down? Is there any technology or strategies that they can use?
Yes. So one of the things I recommend is that they get an outline from their teacher so that they can fill in. So we know actually that taking notes on a computer is not the best way to take notes because you are just transcribing and you're not getting the information in your brain in a way that's important. So the important thing about note taking is that you're actively listening to what someone is saying and picking out the parts of what they're saying and jotting it down. So what they can learn is to just jot down a word, just listen and jot down a word or two, and then fill it in later. What is really nice if they can fill that in from an outline already given from the teacher. If not, I would suggest recording the teacher, writing down a few things, even if they can barely read what they've written, but to learn not to write everything down, it's going to take too long, but write down, that word sticks in my head. What he just said there, I'm just going to write that down. I'm going to come back to it after class, and either with using a tape recorder or, on my phone, having recorded it, listening again and filling in the blanks. So those are some things. There are also smart pens where you can take notes where the pen actually records for you. You're taking notes, writing some things down, and the pen will, you put it at the word you were using and it will start the recording at that particular time. So that's a really good use of technology that I think can be very useful for kids. But I think involving the teacher in this process is a helpful one. And one last thing is getting notes from another student. That's a lot easier to do in college, but I suggest that if the teacher doesn't want to give the notes, then having somebody in class to be the note taker or something. But if the child needs to study from his notes, he needs to be able to have notes that are worthy of studying from. it's important.
Yeah, that's super helpful. We are about out of time, Ellen, but I do want to give the last word to you. If you have any final words of advice or suggestions for our parents out there who are watching, the last minute is yours.
Oh boy, okay. So I would say that, one of the things I always like to say is that this is not necessarily a bad thing. To have slower processing speed is kind of a normally distributed thing in how our brains are structured. And 40 years ago, it was not a liability. Today it is because of the world that we live in. And I would challenge parents to look not just at their child and their child's what they might determine as deficiency or describe as deficiencies. I don't really think they are. I think in many ways they're strengths. And what we are really craving in this world are more quiet, more time to enjoy our lives. It's the rare person who's like, I want more. I want more noise. I want more, And so there's a lot that we can learn from kids who have this normal pattern, really, in a lot of ways, and to look at what it is that they're getting in the school environment or in the social environment that parents could better advocate for. The reason why these kids are struggling more is because they're being asked to do more. And I'm not sure all of that is really good for them. So I think thinking about ways in which we as adults can change their world so they don't feel so left behind, I think is something I would challenge parents and those of us who work with kids to do.
Absolutely. Ellen, thank you so much for being here today. And thank you to all of our viewers for joining us. We did have a lot of questions come in today. I know we didn't get to all of them, but if you still have a question that you want to ask, I would encourage you to join our community. Lots of families are active on there, answering each other's questions, giving advice, and sometimes experts like Ellen pop in and answer questions as well. So you can find that at u.org/community. And you can also look at our upcoming chats, just like this one. You can view our old chats. If you missed part of this one, you can go back and rewatch it. You can find that at u.org/calendar, or you can also find it on our YouTube channel. And speaking of YouTube, if you enjoyed this chat, please be sure to subscribe so that you can see our upcoming expert chats. Thanks again, Ellen, and thanks everyone for joining us.
Bye.
Are we out?
I think so. I think so.
All right, cool. All right, Ellen, I will be right up.
Okay, good.
That was so great. I can tell you speak about this a lot. You speak very eloquent.